Hello. Hello, Dr. Freeman. My name is Kathy Gregory, and I chose Native Americans and substance abuse for my topic for my video. Okay, we'll start out with the population of American Indians. In the year 2010 was 2.9 million, and that's less than 1% of the United States population. The actual percentage is 0.9%. Of that, about 34% of American Indians live on reservations, and about 57% live in metropolitan areas. The poverty rate is double of anyone else in the United States on average. Indians see themselves as an extension of their tribe. Tribe and reservation provide American Indians with a sense of belonging, security, and an interpersonal system. Indians who leave the reservation to seek greater opportunities often lose their sense of personal identity since they lose their tribal identity. American Indians have suffered greatly as a result of colonization, disease, and land distribution. Their culture and language was systematically stripped from over 125,000 different tribes. During that time, they took Indian kids and put them in the homes of Euro Americans, and they were forbidding to speak their native language or have anything to do with their culture. They were considered savages, and they were trying to Americanize them. And stripping the American Indians of their culture, we believe, is a reason for their high rates in alcoholism. Alcoholism among Indians is 6 times higher than the national average. Substance abuse is one of the greatest problems faced by American Indians. It's very common for an Indian to start drinking at a very early age. In Alaska, 32% of American Indians start reporting drinking very heavily by childbearing age. Heavy consumption is associated with a feeling of powerlessness. It's also related to low self-esteem, cultural identity conflicts, lack of positive role models, um, childhood maltreatment, social pressures, hopelessness, and a breakdown in the family. An example of how Indians can feel about being powerless and hopeless is the fact that a lot of sports industries are refusing to change their mascot, and not necessarily for monetary reasons. It's basically they don't care because the Indian population is less than 1%. So that's not a lot of power there. Okay, and Donovan Antelope, which is a spokesman for the Northern Arapaho tribe, says that alcoholism amongst Indians has been a problem for over a century. Alcoholism among Indians are also considered to be the reason for domestic violence among the Indians. American Indian women suffer a rate 3.5 times higher than any other group of women nationwide. And they believe that is a result not only from the alcohol, but also a result of the traditional roles of men and women have been broken down um, over the years because they've been stripped of their natural culture. Suicide also is a problem, and which is alcohol related as well. Indian youth are have twice the rate of anyone else in the nation at attempted and completed suicide. Adolescence from adulthood is the time when the greatest risk for suicide appears, and especially for males. Deaths due to alcohol-related issues is 12% of Native Americans died to alcohol-related deaths. Um, um, and of that, 6.6% of alcohol-related deaths are homicide, 5.2 are suicide, and 2.2 are due to falling down because they're too drunk. Uh, the Federal Center for Disease and Control and Prevention found that 11.7% of deaths among Native Americans between the years of 2001 and 2005 were alcohol related, compared to 3.3% for the U.S. as a whole. And I'm sure those statistics have went up since then. There was a study that resulted in 68% of Indians whose deaths were attributed to alcohol were men. 66% were younger than 50. 7% were less than 20 years old. The two leading causes of alcohol-related deaths among Indians were traffic accidents and liver disease. There are many more alcohol-related deaths than the study shows, but they didn't include a lot of other important risk factors like tuberculosis, pneumonia, and colon cancers, with alcohol is said to contribute to those things. In general, American Indians suffer a much higher death rate than most leading causes than the rest of the country. Uh, um, Besides alcoholism, you have drug abuse, diabetes, heart disease, and suicide. After this study, it's recommended that culturally appropriate clinical interventions are done to reduce excessive drinking and to better integrate the tribal healthcare centers and tribal courts, which often deal with alcohol-related issues. And what I have as a solution to this problem would be, before working with American Indians, I think we should explore the ethnic differences in values, determine the cultural identity of the clients and the members and their association with their tribe or reservation, if any, understand the history of the oppression that they have been through, assess the problem from the perspective of the individual, the family, the extended family, and the tribal community if that's necessary. And address, because they are well below poverty level and worse than anyone else in the United States, if necessary, address basic issues first, such as clothing, food, shelter, um, address those issues before we even get into the council. And sometimes um, it might be necessary to address with the adolescents and the kids, to talk to them about their cultural values and whether they think the unreceptiveness of their culture in the environment they live in might possibly be part of the problem that they're having with the alcohol or the drug. To help determine concrete goals that incorporate culture, family, extended family, and the community perspectives. We should include elements that focus on holistic values such as mind, body, and spirit being as of one and connected. And I think if we do these things, then we would have um, more, it would be more effective in reducing the alcoholism associated with American Indians and in turn reduce the death rate due to alcoholism amongst the Indian population. And those are my thoughts, and that's it for my video. Thank you for listening.